For myself, living in such a remote area, to have the Bush Nursing Centre, you'd be totally lost without it. And certainly for someone like my dad, who's 90 and relies very heavily on aged care, certain medications and so on and so forth, it's right here for us. It's incredible, really, for such a small area.
Well, if we didn't have this here, the closest, medical place would be ACMI. But then if you've got anything serious, you've got to go down to Bairnsdale. But it's been good here because if you have an injury or that's at any time of the day, they're on call and they can help you out. It doesn't matter what's wrong.
As soon as I walked into the Bush Nursing Centre, I was just amazed. We just couldn't manage without the Bush Nursing Centre. They're just marvellous. We have been here just over 12 months. We have a son living at Enso, which is 12 minutes away. Vince was very ill at the time and we wanted to be closer to son and granddaughter. So that's the reason why we moved up here.
You want the last one, don't you?
Yes, I do, yeah.
Well, why don't we make it the Tuesday at 4 o'clock?
That's great.
Okay. 15 years ago, there was a job advertised for a relief bush nurse, so I applied for that, and that was weekend relieving. So I started up here then, and have continued ever since. I've done 18 months full-time, while Pauline, who was my predecessor, took extended leave, and then 3 months ago I've taken on the role as bush nurse manager in a permanent position. Bush nurse in this area is a very diverse role. You do comprehensive assessments of all the clients that come in that you see. You do a lot of counselling, grief counselling. You do emergency treatment. We've got a treatment room where if somebody came in with chest pain, then we do all the assessments, give them their immediate treatment, call the ambulance or the doctor, have them transferred out if they need to go. We do immunisations, women's health. We do veterinary work as well because people bring their cats and dogs in when they need their sutures removed or a tick removed or to look in and near because their dog keeps flicking their head. So, it's a bit of everything. So you've got to be prepared. You never know what's going to come in the door. So the Bush Nursing Centre in Swifts Creek actually commenced in 1918. And at that time, the bush nurse had to ride her horse to do her home visits. So actually a few weeks ago, we had basically a cyclone in Swifts Creek where there were trees falling everywhere and power out. And I was in the car and I got trapped between two trees that had fallen either side of the road, so I couldn't even get back. And I thought, imagine being out on a horse in weather like this, going out to people to assist them. Then they graduated from the horse to a push bike, which would have been harder than riding a horse. At least the horse did the work. And then gradually we've sort of moved on. We had a sedan for quite some time and we've upgraded to a four-wheel drive because it is such a mountainous area and it can be quite rugged terrain to get into people's properties because there's not main roads. There's a lot of tracks and you have to go through creeks to get to there. So we've graduated up to the four-wheel drive, which makes it a lot easier to get around, a lot more functional. And nobody has to feed the horse when you pull up at their place, which was their job years ago. For our emergency care in?
The community really appreciates having a bush nursing centre, and quite a few years ago there was discussion of the bush nursing centre being taken over by the Bairnsdale Hospital. The community had a big meeting and they said that just was not going to happen. They still wanted it to function as it was, so that there would be a nurse here 24 hours a day. A lot of people say, oh, well, not many bush nursing centres are open 24 hours a day or have an on-call nurse 24 hours a day, but people don't get sick just Monday to Friday, 9 to 5. We have a lot of elderly, isolated clients in this area, and we actually have one of the nurses does elderly home visits once a fortnight around to the areas. Some of them don't. Some of the clients are very elderly, don't drive, have poor vision, and are out there on their own caring for themselves. They have home help go in and help them. Leo is one of our clients. He's almost 90 and his wife passed away nearly 3 years ago. She was his carer, but he relies on his family and the services of the Bush Nursing Centre so that he can stay in his home for as long as possible. I'm just going to put the light in your ear. Tell me, Mark, if the light goes straight through, won't you?
My dad relies very heavily on the Bush Nursing Centre that's right here for us. Otherwise it would be very difficult, travelling an hour to Bairnsdale to get assistance and that. It's 24 hours, it's amazing, so you can call at any time, day or night, and the assistance is there.
When we first moved up here, I was quite apprehensive about the nursing and the doctors because at any time Vince does need help. So when I first arrived here, I went down and introduced myself to the Bush Nursing lady who was here at the time, Pauline. From the time I introduced myself to Pauline, she was up every day. If she couldn't make it, she'd give me a phone call to see how Vince was going.
We've got lots of young mums in the area with their young children, so they bring them in for assessments. We've got a little fellow who has had a cough for a couple of weeks. Quite often that's just a cough from teething or just a viral infection, but it's reassurance for the mothers to make sure that their bubs are all right.
It's a lot easier having a baby in a small community where you have things like this, like the bush nurse, and instead of having to live in a big city and there's no one really to help you. So yeah, I'm kind of a local now. I've been here for about a year and a bit. But yeah, the community's awesome. We love living here.
After travelling for so long all around the world, it's actually peaceful. It's wonderful to come home and spend some quality time with family and probably do a few more years back in the city somewhere. But this is where I'll retire to. I love it up here. Beautiful.
Oh yes, we won't move from here now. I love it. It's just nice and quiet. Everything is here that we need. As I said, the bush nurse, which is the main thing. We got a nice hotel, nice meals, nice good baker. Just everything is at arm's reach.
When I applied for the position, because Pauline had been in the position for 22 years before me, they asked me if I'd be doing the same. I said, I don't think you'll get 22 years out of me, maybe 20 might pull me up. So yes, I'm in for the long haul. It's definitely my career choice now.